Thank you all for being here at our third testing site at Rainier Beach High School. I'm visiting Rainier Beach and the free mass distribution and thought it would also be an ideal opportunity to speak about our next site for free testing in Seattle, and that's in West Seattle. We are still in the middle of a global pandemic, the most significant public health emergency that our city has ever faced. As the first major U.S. city with the first confirmed cases in our region, we learned early the value of strong regional partnerships and just important of how important it was to follow the science if we wanted to save lives. We saw the failures of this Trump administration from calling COVID-19 the common flu to refusing to implement a national strategy on PPE, or reopening or testing. We have had no national leadership on this issue, which has made it all the more important for local leaders to stand up and work together. And I'm really proud to be here today with one of our city council members who's leading for her district on these issues as well. Tammy Morales, who's right here. Unfortunately, the failures of leadership have led to more than 172,000 American deaths and 5.5 million positive cases. Cities have become the safety net. We are working hard to implement policies to protect communities and to make sure that we can help save lives. In Seattle, we implemented one of the first residential and commercial moratoriums on rent in the nation. And just a week ago, I extended it with the help of City Council through the end of the year. We lit on this issue because we know how hard this has been economically for so many people, and that communities of color have been disproportionately impacted, and renters don't know how they can pay their rent. We cannot afford for more people to go without housing during this time. We also collected and distributed more than 1 million items of PPE to first responders, to community health clinics, to shelters, and long-term care facilities throughout our region. We are deferring utility payments, delivering millions of dollars in rental assistance and grocery vouchers to families that need it. The city has stepped up and done so much because the need is so great, and because if we didn't, the gulf would be so great. I can't talk about our response on COVID without talking about Chief Harold Scoggins and the Seattle Fire Department. Our fire department has taken on a new role in leading on our testing efforts across the city. Months before the citywide testing, they developed a pilot testing programs to test in long-term care facilities. They are the first in the nation to set up a testing facility for first responders by first responders. And the pilot was so successful, it's been copied and expanded to so many places. And we were able to expand it for city workers and then for city residents. Exactly 11 weeks ago, although it seems like dog years, I announced the location of our first 2 citywide drive-up testing sites in South Seattle, the Soto neighborhood, also in Councilmember Morales' district, and in North Seattle on Aurora. 3 weeks ago, we announced our third site, this walk-up site right here, Rainier Beach High School. The very day we launched it, we were able to announce that the city had done 100,000 tests. To date, we've done over 125,000 tests. About 15% of all tests statewide are done in the free city locations. Soon there will be a 4th site. The director, Hayes, was not able to be here today, and she regrets that, but she did send along some information from Seattle-King County Public Health that I want to share with you. Our case counts have been relatively stable since mid-July. Weekly counts for the last 7 days, August 10th through the 16th, were about 12% lower than the previous 7 days, and that's really good news. We had seen cases on the rise, particularly with young people. We'd seen that in other parts of the country, and that kind of rise spread from the young people to more vulnerable populations, resulting in a rise in hospital and deaths. We haven't seen that right now. Ours now again are at a plateau and slightly down. In Seattle, the average is approximately 32 cases, but our hospitalizations are stable. Younger residents under 40 still are the majority of new cases. And I want to tell, please, you younger people, you're not as invincible as you think. You must wash your hands, wear face coverings, don't have gatherings. We have seen multiple gatherings that have led to a lot of infections, like we did at Greek Row and the University of Washington. We also, unfortunately, are continuing to see heightened disparities in communities of color, sometimes 3 to 5 times higher than white population. In Seattle, that's particularly true in the Latinx population, and we're doubling our efforts to make sure we can reach those communities with trusted community partners. I really do want to take a moment to commend the efforts of Seattle residents and businesses through this pandemic. They've done everything that we've asked them, and the data shows that those efforts have paid off. We flattened the curve, we brought the infections down, we lowered our hospitalization and death rates. Compared to major cities of our size, we have some of the lowest case numbers, even though we were one of the original epicenters. But it has had devastating economic impacts on families, on workers, and on small businesses. We know we have to continue to support those individuals and residents and businesses, but we also all have to keep doing our part to keep the virus slow in spreading. We are the only defense against this virus. There is no vaccine, there is no cure, and they're just starting to discover treatments that make it less deadly. So while today we're announcing the expansion of the City of Seattle sites, I want to remind everyone, these are accessible to anyone. You can register online, and then you can get tested. If you have symptoms, if you have any symptoms, I urge you to get tested immediately. If we can catch people while they are symptomatic, we can slow the spread of the virus significantly. Our next week, we'll be opening the other testing site I talked about at Chief Sealth High School. At the athletic complex, I want to thank the principals of both Chief Sealth and Rainier Beach High School. They've been great partners in allowing us the area to set up this testing. In West Seattle, the testing will be operating 5 days a week from 9:30 a.m. to 5:30 p.m. I also want to thank our great partners at the University of Washington Medicine and Public Health King County. We wouldn't be able to do this work without them. Altogether, the City of Seattle will administer up to 4,000 tests per day. Let me say that again, because if you remember where we were at the beginning of this crisis, where testing was almost non-existent, we will be able to do tests of almost 4,000 tests per day and 75,000 per month. This is going to be so critical to us keeping transmission of this virus, because if we get someone who tests positive, we can get them into isolation so they don't transmit it to others. We find out who they've had contact with. We test the people that need to get tested, and we get them isolated, and we can really slow the transmission. Anybody who wants a test, it is free. To register, you can just go to seattle.gov/COVID. If you don't wait to be tested. If you are experiencing symptoms, we will take you the same day. I want to close by saying again, we could not do this work without great partnerships with Seattle Fire Department, Public Health, Seattle King County. King County itself has just been an amazing partner, and the University of Washington physicians. But there's nothing the city couldn't do on this front if we hadn't had the great collaboration that we've had between my office and the City Council and all of the city departments. And I'm proud now to introduce the council member for this district, Tammy Morales, who has just been a person who unrelentingly is looking out for the interests of this community, not just on COVID, but on all other issues. And it's a real honor to have her with us today. Councilmember Morales.
Thank you. Good afternoon, everyone. Thank you for being here. Thank you, Mayor. I'm Tammy Morales, proud representative of Seattle's District 2. And I am also pleased to be part of this conversation and this partnership between the city, between the fire department, public health, Seattle King County. We're here to remind everybody to get tested and to mask up. I was speaking with some of the folks staffing this walk-up facility who told me that we are now able to test at this site about between 600 to 800 people a day are coming through, which is incredible. It only takes about 4 minutes, even when the place is full, to walk through, register, and get your test done. So I really want to encourage people to come through and get yourself tested. I want to take a minute before we go any further to recognize again the first responders represented here by Chief Scoggins and also Director Patty Hayes, who wasn't able to make it. Our first responders are risking their own lives, putting their own health and safety at risk every day so that our neighbors and our community can be safe. And as we know, since March, more than 6 months now, it's kind of crazy to think, thousands of our neighbors have continued to show up for work. Public health nurses, firefighters, paramedics and childcare providers, but also grocery store workers, bus drivers, scientists, and so many others. These are the essential workers, many of whom live here, and this is a part of town where we are seeing continued increase in cases. Part of the reason is because these essential workers live down here in the South End. Thanks to them, many of us have been able to do some of the daily things that keep our families going. And I want to thank them again for serving our community when we need it the most. But despite our best efforts, despite the innovation of the scientists in our community and the healthcare workers, despite their dedication and their hours and hours of overtime, we are still not meeting the daily target for lowering new cases of COVID-19. I think the mayor and I agree that one thing we need is to reach out to our city's Black, Brown, and Indigenous community members, many of whom call the South End home. And as the mayor said, it is true that our communities of color, particularly Black and Latinx communities, are suffering disproportionately from the impacts of this disease. But while South Seattle does have the highest rates of positive tests, according to public health, that trend doesn't have to continue. And that's why I'm here today, because I want to make sure that everyone understands how important it is to mask up. My mask protects you, and I want our young people especially to understand. Your mask protects me. It also protects your grandmother, your aunties, your best friends. That's why it's important for all of us to mask up. COVID-19 is no joke, and until we have a vaccine, we have to do what we know works best to keep our community safe. Wash your hands, stay 6 feet away from one another, and mask up. Thanks for being here, and I want to remind folks that there is mask distribution happening for the rest of this afternoon right over down the street at the Rainier Beach Community Center. Thank you.
Good afternoon, everyone. My name is Harold Scoggins, Fire Chief of the City of Seattle. Mayor, thank you for your leadership. And, as the mayor mentioned, we have really been leading the nation on this front. A lot has happened over the past few months. And as I look back to February, and I'll even look back further to January, because that's when we started paying attention to the spread of the virus and has watched so many things that have taken place over the past 6 months. I, or probably none of us, could have imagined we'd be in this place today. But one of the things I am most proud of is, once again, our firefighters have stepped up to stand in the gap to help community. And that's really what this is all about. As we leaned into the virus, as the mayor mentioned, one of the things that we knew we had to do was figure out a way to keep our first responders safe and to keep them healthy, to continue to respond to emergencies each and every day. Because we knew in this time our community would need us. And that's when our firefighters had the idea, as the mayor mentioned, to set up our first responder testing site. And that's where our first partnership came in with the State of Washington Department of Health that actually gave us permission to do that. And that was really big for us. And it's important that everyone here know that one of our firefighters, Lieutenant Brian Wallace, is here right now, actually led the idea and created the concept of all these things that you see today, and it's evolved in so many ways. As the mayor mentioned, we set up sites to test our first responders. We tested in our long-term care facilities, nursing homes, assisted living facilities, adult family homes. Because we saw a gap, we partnered with Seattle King County Public Health, and thank you to Director Patty Hayes for that partnership. We went in there, our firefighters went in there, not only did we do testing, we trained a lot of the staff so they can continue the testing on. And then we kept evolving as we started watching the numbers out in the field. As we noticed people were passing away out in the field and the conversation started. We didn't know if they were passing away of COVID-19. Our firefighters then started testing those who passed away out in the field, which evolved into the community testing sites. And it's really interesting how this has evolved, because since June 5th, as the mayor mentioned, we've tested over 125,000 community members, trying to stop and flatten the spread of COVID-19. That could not have been done without the partnerships of the University of Washington, this current partnership with Seattle Public Schools. Thank you to Rainier Beach's principal and Chief Selt's principal for believing in us and creating this partnership. And thank you to our mayor for believing in us and giving us the ability to figure out ways to help and serve community even more. We're really excited about opening up this 4th testing spot, because what we know is there is a need in West Seattle. You know, there's some challenges there with the West Seattle Bridge being closed, the lengthened time to travel, maybe to your primary care physician. So we've been working hard to create a way for the residents of West Seattle and those residents that may be south of Seattle to get tested. So that partnership was really important for us. As the mayor mentioned, we will be opening next week, and the hours will be from 9:30 a.m. to 5:30 p.m. And you can register online, and that's what we really recommend you to do, because to really turn the process over in a timely and efficient manner, that's the best way to go at seattle.gov /COVID-19, and you can sign up and get tested. But I do want to put a book in that no one will be turned away. Matter of fact, if you're exhibiting signs and symptoms of COVID-19 of what you think could be, we encourage you to show up, walk up. We will get you registered and we will get you tested. One of the things that we know in order to flatten the curve and stop the spread is we need to find out who has COVID-19. So any of our 4 sites, please walk up. We will get you signed up and we will get you tested on site at no cost. That's really important. The partnership with the University of Washington has been critical in this venture. The UW Labs has been an amazing partner, picking up the tests, transporting them to the labs multiple times a day so you can get a timely turnaround. Currently, it's taken about 72 hours to get your results back. But one of the things I'll tell you, they're working on this each and every day to try to bring that timeline down. You know, and the Seattle Fire Department, we've been touched just like everyone else. 28 of our firefighters have contracted COVID-19. And we've been fortunate. None of them have required hospitalization, but that's also required 159 of our firefighters to be placed in quarantine and/or isolation. And our last 5 are set to come out hopefully in the next few days. Because it's like I said, we can't respond to you and help you if we think that we may be transitioning the virus. That's why it's so important. So many partners have created this opportunity for our community. Firefighters continue to find ways to stand in the gap, but none of this would be possible without the leadership of our mayor and giving us the ability to get creative and do new and different things. Thank you. I'll turn it back over to Mayor Durkan for questions.
Thank you, Chief Scoggins. And I just want to emphasize again, from the beginning, Chief Scoggins and the fire department have been just enormous partners and leaders here. Each step of the way when I would say, look, we don't have any testing. Do you think you could do it? And he'd go back, he'd talk to Brian and come back and say, yeah, we can get going. So we saw one of the things that drove the deaths and hospitalizations early on was that our senior centers were hit very, very hard. And we saw senior center after senior center where so many people were infected and were sick and were dying. And that was one reason why we started the testing there, and the chief was able to get our medics trained up. Our ratio now for our senior centers, we brought that number down very low, and it's one of the reasons transmission rates are low and hospitalizations are low. When we needed to test first responders to know whether we could get them back in the field, our fire and police who are so vital to our services, we were able to get that up and running. And then when we said we couldn't rely on anybody else to do testing for us, we were going to have to do our own testing, we started standing up testing sites like this. And now we account for 15% of the tests that are run in the whole state. So step after step, the partnership with UW, with the fire department, and Seattle Public Health King County has just been terrific. I also want to thank Chief Scoggins and the fire department for their response earlier today. There was a significant fire on Beacon Hill. Fortunately, no firefighters were injured, but it shows you that even in their day jobs, they face a lot of danger and are exposed to a lot of toxic chemicals and smoke that also make them also vulnerable to getting COVID. So with that, if there's any questions for the chief, for Councilmember Morales, or myself, we'd be happy to take them.
What day are you starting testing?
August 28th. And that's in the West Seattle site. It's already active here. See, we've been really trying to locate testing where we think there's a great need. Clearly in the south end there was, so we started in the south end first with the boat launch ramp where we had the testing facility with the University of Washington. When we knew they had to pull out, we set up this one. West Seattle has so many mobility challenges, it's very difficult for people to get out of West Seattle to a site, so we wanted to make sure they had that there. Just as we put additional fire rigs and responses in West Seattle, having this public health response in West Seattle is critical.
With the multiple sites and being able to take hundreds of people through a day, are you asking everybody to come out here, symptoms or no symptoms, just to find out if you have it? Like if you're feeling fine, should you still come out?
So we would encourage, the number one priority is if you think you have any symptoms, get tested that day and we will find a way to test you. If you think you've been exposed in a way that you might have symptoms, you can get tested. If you don't think you've had exposure and you're not suffering any symptoms, you don't need to get tested. But we really want to make sure that if you have a doubt, to get tested. But again, number one, any symptoms at all, get tested. Those are the people we want to test, because the period of time that people can have and transmit the virus is up to 2 weeks before they feel symptoms. And so by the time you have symptoms, you definitely can spread the virus more. So if you've been exposed, get tested. If you are experiencing symptoms, get tested.
How many people a day can the new site test?
The new site can test
Probably about 1,000.
about 1,000.
And is it going to be the same sort of system here where you park and then walk through?
Yes.
And why is that more efficient than having folks drive through here?
You know, it's all about getting creative. We work with what we have. If you notice, the first two sites are the old emission testing sites, so it made sense for efficiencies to create those drive-through paths. We could not find other locations like that, so our team got creative and figured out other ways to get it done. And so that's a way to get it done. If you've been to Chief Sealth High School and you know the football field is right across the street, there's that large parking lot. That's where we'll be setting up. In that large parking lot, people can park just like this, get out the car and go get tested. It's also ADA accessible. So if someone has an ADA concern or an issue, come to that site or come to this site and we'll make sure you're taken care of there also. But it's all about what was available.
What languages will you have interpreted?
We're able to interpret a number of languages. We have access to language line, and we have different individuals on site that speak different languages. As you can imagine, our 911 dispatch center is able to interpret multiple languages. We have the same access to our language line at all 4 of our sites. So if someone shows up and we need an interpreter, we'll figure that out through the language line process.
And on-site interpretation, which languages?
On-site interpretation through the different languages through the phone system, if necessary.
So you won't have actual people interpreters there?
It depends. Some days we may and some days we may not, but it may not be consistent enough. Just like through our 911 dispatch center, if someone calls in a different language, we have access through language line to do the interpreting for us. So that will not be a hindrance for anyone.
Do you have a number or a percentage of how many positive you're finding with these sites?
Sure, over the last 2 weeks, we're running about 2.4% of all the tests that we do are positive. So if you can imagine on 1,000, that's about 24, and we're up to about 3,000 a day right now. So times that by 3, so about 75 a day. And the way it works is when a person gets a positive result, they receive a direct contact from a member of the Seattle Fire Department notifying them of that positive contact, and then we'll turn it over to Seattle-King County Public Health for the additional contact tracing that needs to be done so they can notify others that have been around them to try to limit the spread.
How much does each site cost?
Well, it's hard to say right now because there's different costs involved. It depends on the type of test, the number of tests. It depends on the leasing costs of the sites, and the partnerships make a big difference. The emission sites are one cost because we've leased them. The partnership with the school districts are very different. So it depends on the volume, it depends on the site, and it depends on the number of personnel that we have to staff the site. So it becomes very complicated to accomplish that, but we can get you that.
Okay. And what's your budget for the Chief Seattle site or Chief South site, and how long do you have that for?
Well, the length is probably easier to answer. We're going to be at that site indefinitely until the city doesn't see a need or the school district needs that site back because the schools are reopened. You know, part of our goal is the more testing we can do, the quicker we can bring down the spread, and the schools may have the ability to reopen. Then we'll vacate that site and this site. But we're also looking for additional sites in case we have to do that. The budget question is going to be similar to our other 3 sites, and it's just going to depend on the volume and capacity and the number of workers.
What are the demographics you're seeing at this site with regards to age? Like, are you seeing an even spread of younger and older folks getting tested, or is it more one category than the other?
I don't have that, but Lieutenant Wallace, do you know that information?
It's pretty even. Pretty comparable to the other sites.
If you didn't hear, it's pretty comparable to the other sites, but we can get you that information. Each day we have a daily report that we send out. Thank you.
Thank you, everyone. Do you want to say some final words? Come on, it's your district.
Thanks. I just want to again remind folks: get tested if you think you had symptoms, if you think you've been exposed. We've got a really efficient system operating here. I think part of the reason, as Brian was saying to me earlier, that we're doing walk-through instead of cars is because of the limited space. Having a bunch of cars here takes up a lot of space, but we can put more people in line if they're just walking up. So the ability to run people through, even if it's full, takes about 15 minutes to go from the beginning to the end. And that is, as the chief was saying, how we will stop the spread. So get tested if you've been exposed or if you think you're having symptoms. And always wear your mask. Please wear a mask. Thanks, everyone.
Chief, I have a question for you. It's off topic.
Sure.
Thanks.
Because he shouldn't have said sure. I'm not sure what's coming.
Could you talk about the Scoggins fire this morning, the big fire? Just tell a little bit what happened.
Probably at around 5:15, I'll be doing a briefing over at the site, if you'd like to go over at the site. So I'll be gathering some more information between here and there. So I'll be there at 5:15 if you want to hold that question for about an hour. I'd appreciate it.
And were you there on site?
I was.
It sounds tired. A long day for you.
That's okay. I enjoy long days. They're good for me. All right.